We're joined now by Dr. Jacqueline Feldman, Scientific Program Chair. Thank you for joining us.
Thank you so much for having me.
As the Scientific Program Chair, your job was really to come up with what was going to happen for this year's meeting. So tell me some of the things that you did.
Well, there's a zillion things for people to do. For me, the highlights have already been, and there are some coming. Last night we had Altha Stewart give her final presidential speech where she talked about inclusion and diversity and really challenged the APA and the leadership to embrace that going forward, and I think that was really important. But some upcoming highlights are we have Lejeune Montgomery Tabron, who is the Kellogg Foundation person, speaking at Convocation about health equality. We've got the 175th historical anniversary of the APA. So we have all these wonderful tracks where you've got these wise old heads, of which I'm one, giving talks, but they're really, really cool and they're really very interesting. For the younger crowd, I think we've got a lot of things that they're really going to like. The innovation labs are some, and the hands-on labs where they can really kind of get in and muck around and see what the new innovations are going to be some really important things for them to attend.
So this year's theme was Revitalize Psychiatry, Disrupt, Include, Engage, and Innovate. So how did that shape the scientific program?
We had a lot of fun coming up with that theme, particularly the word disrupt. Not that it was a negative connotation, but it kind of opened the doors for us to think a whole lot more broadly about who we want to include, how we inspire people to kind of bring their energy to it. So it broadened the net of who wanted to come and speak and who wants to come and listen. But it also encouraged us to change the formats of how we present. Instead of just giving a didactic lecture, what we wanted to do was offer people the opportunity to engage the entire audience, role-playing, voting, those kind of things. So using the theme, we really kind of, I think, energized the entire meeting.
Well, talking about that energy, which sessions are you most excited about?
Well, that's like asking a mom who's her favorite child, and that's really, really hard. I like the 175th anniversary historical lectures because I'm a history buff, and we've got some of our older, more seasoned, more mature clinicians who are going to be talking about that. But then we've got some youthful things going on. As a matter of fact, I'm participating in an intergenerational talk. It's called Baby Boomers and Millennials. How do we kind of bridge the gap? So we have young APA members, we have older APA members, we actually have a couple of non-APA members who are offspring of people who are on the panel who are going to come in, and we're going to see if we kind of bridge those differences between baby boomers and millennials.
Dr. Jacqueline Feldman, thank you so much for joining us.
Thank you so much. I appreciate it.